Hi, my name is Dr. Eric Mall, and I have the privilege of working with the Airrosti Rehab Centers as a member of their clinical development team. Today, we're going to talk about a very common term you may have even heard of. It's called sciatica. Sciatica, we often think, is radiating pain down the leg. And there is some truth to that, but there's a little bit more information that we'd like to dive into today. So what we're going to talk about is what is sciatica? Who does it affect? What are some common conditions that are associated with sciatica? Or what are some common conditions that may present like sciatica? And then we'll talk a little bit about some imaging indicators. When do you get an MRI? Is an X-ray even needed? And what are some traditional treatments? And then we'll talk about what is Airrosti's approach to the treatment and management of sciatic-like symptoms. Let's begin by talking about what is sciatica. Now I have Kelly here to help demonstrate where in the body sciatica is often referred to. Before we begin, we need to understand that sciatica is not a condition, it's actually just a list of symptoms. Most patients list those symptoms as radiating pain down the buttock, into the hamstring or the back of the thigh, down into the calf muscle, and even into the foot or sometimes the greater toe. Now some patients often list that their sciatica comes down and radiates into the front of the shin. Other individuals may complain of symptoms that are also associated with that radiating pain, such as tingling and numbness, or pins and needles in their leg. So let's take a closer look. Here we have a simple representation of the spine and pelvis. To get a better understanding of why sciatica is a symptom and not a condition, we need to understand what the sciatic nerve is once again. So, what forms the sciatic nerve? We have in the lumbar spine, or the low back, some nerves that exit the spine along with the sacrum, and they form a nerve called the sciatic nerve. That nerve comes out of the pelvis, goes underneath some muscle structures and some other soft tissue, and then eventually goes down into the back of the thigh and into the leg and branches off to feed those structures as we've discussed earlier. So there are some conditions that can irritate these nerves, or the sciatic nerve, presenting us with sciatica. Some of those conditions are a disc herniation, irritating the nerve, giving you the sciatic symptoms, that numbness and tingling. We can have muscle structures, which is very common to have. These muscle structures become irritated, whether from previous trauma or injuries, or even from overuse or lack of use, and they'll become increased and toned, or they'll begin to develop scar tissue attaching to that nerve, and they too can give the same symptoms of radiating pain down the back of the leg, into the foot, or even into the calf muscle and shin. We can have hip problems referring pain down that same sciatic pattern, or even gynecological conditions such as endometriosis has been discovered to refer pain down the back of the leg and often down into the foot. Understanding all these conditions will help us better understand how to effectively treat and also provide you as a patient with an effective treatment plan. Once we understand which one of these triggers is actually stimulating that sciatic pain, we can often have a better opportunity in resolving that injury. Okay, so let's talk about who does sciatica affect. What we do know is individuals with low back pain are at a higher risk or chance of having sciatica. It's approximately 5 to 10% of those individuals. But there are some other contributing factors that may increase your chance of having sciatica. It can be, according to the literature, as simple as height, age, mental stress, smoking, or even spending long hours in a vehicle from the constant vibration. Direct trauma is often associated with sciatica, from a direct blow or a fall to that area where the sciatic nerve is located. So some of these factors play a contributing role into potentially having sciatica. Okay, let's talk about imaging. We're going to talk about X-ray, CT, MRI. When are they indicated? And when are they necessary for you to take the time and money to have those performed? Let's begin with X-ray. X-ray often is utilized to discover bone pathology, but sciatica itself is more soft tissue related, meaning it's not going to show up on X-ray. Now, when would we want to use an X-ray? Well, if you came in and you presented with a direct trauma to the area affecting that sciatic nerve, it may be necessary to take an X-ray to rule out a fracture. MRIs are often used and sometimes overutilized. So how do we know we need an MRI? Well, there's two scenarios where MRIs are often indicated in the case of sciatica. Number one, an individual presents with red flags, suspicion of cancer, suspicion of soft tissue deformities, suspicion of bone fractures, or even other pathology. Those indicators are often presented through a thorough exam and history which is done by your provider. The other scenario is when an individual fails to respond in a conservative treatment plan. You go back to your primary care physician. They may then look at your condition and say, I think an MRI is finally warranted. Those are the times that MRIs are often utilized. Okay, so let's talk about some of the traditional treatments that are often prescribed for sciatica. The list is plenty, but let's just mention a few. Bed rests, manipulation, spinal cord stimulation, pain medication, anti-inflammatories, physical therapy, and even surgery are often prescribed for sciatica. Now, some of those have been beneficial and do provide some symptom relief. But there are a few things that need to be investigated. Many of the traditional treatments are designed to affect the symptom and not the condition. So here at Airrosti, we go through a thorough exam, we go through a thorough history, but we also couple that with a functional assessment to determine if there's other conditions or pathology that are triggering those symptoms. And it's then we're able to implement the manual therapy and the active care to help resolve the injury. If you happen to have any questions or would like to know a little bit more information or are suffering from conditions or symptoms that we've talked about today, we invite you to contact us. Don't hesitate. Or you can visit our website. We thank you and have a great day.